comes to abuse, it's obviously a very hard and touchy subject, and it's even more so when it involves a child. Even though we as dental assistants aren't responsible for notifying authorities if we suspect abuse, whether it's happening with a child or it's happening with an adult, we need to make sure that we are speaking up and we're letting our dentists know what we are suspecting and what we're seeing. We as dental assistants spend a lot of time with our patients, and if it's a patient that we, have a chance to have seen over a period of time, then we know, what would be considered normal for that patient. Maybe, how they're acting could be a little bit different. Maybe we're noticing a little bit more injuries or bruising that we didn't notice before. But if we suspect abuse, we need to make sure that we are speaking up. We have a moral responsibility and obligation to inform our dentist as far as what it is that we're seeing. So that way when he or she walks into the room to talk with the patient, they already have a sense from us what it is that they need to be looking for. And then that way they can make that call as to whether or not they do indeed suspect some sort of abuse going on. When it does come to child abuse, there are certain things that we need to make sure that we're looking for. And obviously, the most obvious would be any kind of bruising to the face, to the body, to the arms. Oftentimes, the abuser is going to be coming into the room with the patient, and oftentimes, when we as the assistants are asking questions of the child, it's the parent who is going to be responding and not necessarily the child. That could possibly be an indication for abuse going on. They don't want the child to say something that could potentially, expose them in what they're doing. And again, if we're looking in the patient's mouth and we're seeing injuries like this or even like this, then again, we need to make sure that we are saying something to the dentist, because again, we're seeing the patient first, we're talking with them, we're finding out why they're there. If there's, nothing specific on the schedule that they were coming in for, we need to make sure that we're asking questions and having a clear understanding of what brought the patient into their appointment for the day. So again, things to look for. Any kind of injuries in the various stages of healing, that can be a fresh bruise to one that may have been on the arm or the face for a period of time. Obviously, it can be a little suspect when every time the patient is coming in, maybe every 6 months or 8 months or even yearly, they have some sort of injury. Then that could be, something that might be kind of stand out as maybe a red flag. Any teeth that are chipped or injured. Again, with kids, kids are kids and sometimes they're outside playing. Like I mentioned before, kids will fall off their skateboard or their bike or roller skates, or they might get hit in the face with a ball, or if they're playing a sport, that could injure their teeth as well. So again, making sure that the explanation or cause of the injury seems to be legit. If it's something where the patient is coming in constantly with chipped or broken teeth, then that again could be a red flag as well. If the child has any scars, particularly intraorally, so around the lips, tongues, if there's any tears to the frenums, then again, we need to kind of get a sense for what occurred and what caused that kind of trauma. Because that's pretty extensive trauma that, it's going to take a lot to injure those areas. If the child exhibits any battering or other types of injuries, especially to the face, head, and neck region, again, any bruising to the neck, any bruising to the lips, to the mouth, again, could be an indication of possibly some abuse. Any facial bruises, swelling, black eyes are going to be, somewhat evident. If the child has any bite marks on their body, whether it's an arm, a leg that could be exposed, then again, we want to make sure that we are making note of that and letting the dentist know. And any injuries that, are really not consistent with, the explanation of the parent. So again, those can definitely be some red flags if, the parent is saying, oh, they fell down the stairs, well, it seems like, this child is constantly falling down the stairs, so maybe something more is going on. So again, if you see indications or signs or maybe some emotional withdrawal from the patient or the child, maybe they're not wanting to look you in the eye when you're talking to them, that again could be indication or a red flag that something more can be going on. But and you get a sense for what your patients are like. So if you suspect any kind of abuse going on with your pediatric patients, then you need to make sure, I cannot stress that enough, even if it turns out to be nothing, even just informing the dentist and saying, I don't know, when I looked in their mouth, I'm seeing, some things in their mouth that really look very suspicious to me. And the explanation of the parent doesn't seem to jive with this injury. So maybe when you're looking at or talking with the child, if you can maybe look a little bit more in that area, just to, maybe make me feel better that maybe I'm just reading too much into it. But again, being able to communicate with your dentist, especially when it comes to this, is going to be very, very important. And it's going to be up to him or her as to whether or not this would warrant to get the authorities involved and get child services involved. So it's all anonymous. They won't know who, called in and kind of ratted on them. So it's nothing to be concerned about, but you do need to speak out because you don't want that on your conscience that you suspected something happening, but you didn't want to say anything because you could be wrong and you find out that the child was severely injured or even passed away as a result of being abused, when you could have been the one to have stopped that and caught it early on and prevented the child from having to go through that and to endure what they had to go through.